This episode of NPs POD is sponsored by Privileged Healthcare. Register now at privilegedhealthcare.org or call 310-403-1673. The NPs POD. The NPs POD. Episode 1, What is a Nurse Practitioner? By Leah, the Nurse Practitioner, APRN, FNPC. Nurse practitioners are quickly becoming the primary healthcare provider of choice for millions of Americans. The American Association of Nurse Practitioners report more than 1 billion visits to nurse practitioners each year. So what exactly is a nurse practitioner? We can answer this question by expounding on the education requirements, training laws, and discussing some myths regarding nurse practitioners. A nurse practitioner is an advanced practice nurse with medical knowledge, education, and clinical expertise in diagnosing, prescribing, and treating health conditions with added benefits of disease prevention and health management. They function in settings that were traditionally associated with physicians, such as primary care clinics, hospital ERs, urgent care, or special. These nurses hold either a master's or a doctorate degree, so don't be surprised next time you visit Dr. Leah, the nurse practitioner. Even though the title doctor is erroneously interchanged for physicians, the title is not reserved for only physicians. As a matter of fact, any doctorate degree holder is in fact a doctor in whatever. Because nurse practitioners practice in similar settings as physicians or medical doctors and can be confused for physicians and medical doctors, nurse practitioners who hold doctorate degrees have a moral and ethical responsibility to clarify to the public that they are not medical doctors or physicians, but in fact are nurse practitioners, doctors in nurse practice. Education. All nurse practitioners must complete a master's or doctoral degree program and have advanced clinical training beyond their initial preparation as an RN. During the nurse practitioner schooling, nurse practitioners are required to complete clinical hours and competency practicum. These hours are in addition to years of bedside and clinical experience as registered nurses. Didactic and clinical courses prepare advanced practice nurses with specialized knowledge and clinical competency to practice in primary care, acute care, and long-term care settings. The first nurse practitioner program was developed at the University of Colorado in 1965 by Dr. Ford and Dr. Silver to fill physician shortages. Training. Because nurse practitioners have a combination of nursing and medical education, they bring a comprehensive perspective and personal touch to the healthcare team. To be recognized as a healthcare expert and ensure the highest quality of care, nurse practitioners undergo rigorous national certification, periodic peer review, and clinical outcome evaluation. Self-directed continued learning and professional education is also essential to maintaining clinical competency. Additionally, to promote quality health care and improve clinical outcomes, Nurse practitioners lead and participate in both professional and lay health care forums, conduct research, and apply findings to clinical practice. NP practice. Nurse practitioners are licensed in all states, including District of Columbia, and they practice under the rules and regulations of the state that they are licensed. Some states allow nurse practitioners to practice without MD oversight, and other states require MD collaboration or supervision. Without contest, nurse practitioners provide high-quality care in rural, urban, suburban communities and in many types of settings, including clinics, hospitals, emergency rooms, urgent care, private physician practice, or nurse practitioner practices, nursing homes, schools, colleges, public health departments, you name it. They are everywhere. Whether in collaboration or autonomously, nurse practitioners provide a full range of services, including but not limited to ordering, performing, and interpreting diagnostic tests, such as lab work and x-rays. X-rays do need to be officially read by a radiologist, a physician who has studied radiology. Nurse practitioners diagnose and treat acute and chronic illnesses such as diabetes, hypertension, which is high blood pressure, infections, minor illnesses, urgent or chronic conditions. They also maintain your general health. They prescribe medications and also do medication management in several settings. So let's talk about the alphabet soup. So what exactly do these letters mean? Well, the letters behind the nurse practitioner's name is their credentials. It tells you that they're an advanced practice registered nurse, so APRN. And then, for example, FNP. C, it means family nurse practitioner who's certified. As seen on TV, California AB 890, Governor Newsom signed this bill to grant nurse practitioners independent practice on September 30th, 2020, and it will not be implemented until 2023. So, yippee-yay, California. It has, however, been met with a lot of resistance from, other, especially physician groups, such as Physicians Protecting Patients' Rights or something like that. I guess, So let's talk about it. The California Medical Association, which represents nearly 50,000 physicians in California, argues that the bill, as it stands, does not prioritize patient care. This bill does not mandate that they go to rural areas. It doesn't mandate that they go into primary care, say Dr. Laura Kendall, a psychiatrist, a member of Physicians for Patient Protection. In other news, from housekeeper to nurse practitioner, how this nurse leader climbed the ranks at Bay State Medical Center. Bay State Medical Center hired Jane Andrades As an environmental service worker 10 years ago, today, Dr. Andrade is a nurse practitioner at the same hospital.
I learned as a custodian that every part of the hospital and every person who works in the hospital is important. I hope that my story can inspire people who feel maybe discouraged by their past or where they come from. I just want to let them know if I could do it, anyone can.
This episode of NPs POD is sponsored by Privileged Healthcare. Register now at privilegedhealthcare.org or call 310-403-1673. The NPs POD.